Bladder cancer can cause the death of around 13,000 people in America every year. Dr. Cheryl Lee urges people to pay attention to possible signs of the disease.
Bladder cancer is not as common as some cancers that many may hear about, including prostate cancer and breast cancer. We know that older patients tend to develop bladder cancer. The average age is in the range of 65, so that it's much more common in older populations. Those who smoke are at great risk. So we always want to caution people about smoking, and we recommend smoking cessation programs. Those who have been exposed to chemical agents, particularly at work, industrial solvents, paints, paint thinners, those types of things increase the risk of bladder cancer development, particularly if someone is a smoker. For many patients, there may be no symptoms. When the disease does present, the most common symptom is going to be blood in the urine. Occasionally, it may cause some symptoms in the way a patient may urinate. Frequency of urination, urgency of urination, sometimes pain on urination, or difficulty urinating. As the disease progresses, we may find that there are additional symptoms. Abdominal pain, which is pain in the midsection, pain in the bones. Those types of symptoms are really a reflection of very advanced disease, though. The success of treatments of bladder cancer are highly dependent on what stage the bladder cancer is in. The stage essentially refers to the extent of tumor or cancer, so that tumors that are picked up in the early stage, in other words, those who are just on those tumors that are on the surface of the bladder and not invading the wall of the bladder, those early tumors are highly curable. So catching them early is important. If someone is concerned that they may have symptoms suggestive of bladder cancer, they should see a urologist. A urologist will then do a series of tests in the clinic to help prove that or disprove that. It's very important for patients to pay attention to the symptoms that they may experience. For example, if someone has blood in the urine, they may have the tendency to dismiss that or ignore that. I can't emphasize enough that it is very important for patients with that symptom to be evaluated by a physician. Blood in the urine is never normal, and that should always be evaluated.